The president holds a press conference on acetaminophen and autism. The GAO examines physician consolidation. And time is running out for lawmakers to fund the government before a Wednesday shutdown. For the week of September 29th, 2025, from Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
This is a simple 7-week funding resolution to allow us to do a normal appropriations process, something that Democrat senators have said that they want to see done, but something that Leader Schumer didn't do when they had the majority. They didn't do appropriations bills. This is new leadership. We're trying to do appropriations bills.
Kicking off this week's episode with news from Capitol Hill, where no progress was made last week to fund the federal government beyond the end of the fiscal year on September 30th. The Senate is scheduled to return to session on Monday, September 29th, while the House is not scheduled to reconvene until October 6th, when a government shutdown could potentially be underway. President Donald Trump is expected to meet with Senate Majority Leader John Thune, a Republican from South Dakota, House Speaker Mike Johnson, a Republican from Louisiana, Senate Minority Leader Chuck Schumer, a Democrat from New York, and House Minority Leader Hakeem Jeffries, a Democrat from New York, on Monday. The president has scheduled and subsequently canceled a meeting with Democratic leadership last week. The House of Representatives has passed a continuing resolution that would extend government funding at current levels through November 21st. It includes provisions to extend COVID-era telehealth flexibilities and hospital-at-home waivers in the short term, along with a 5-year reauthorization of the over-the-counter monograph drug user fee program. Currently, the Senate does not have the votes necessary to advance the House-passed CR. Republicans will need at least 7 Democratic votes in the Senate to pass government funding legislation. Democrats are refusing to support any stopgap spending bill that doesn't include an extension of enhanced advanced premium tax credits. The Affordable Care Act subsidies, allowing families with incomes of more than 400% of the poverty line to cap their premiums at 8.5% of income, are set to expire on December 31st. GOP leadership in both chambers have stated that the short-term CR will be free of any policy riders, and that negotiations on an extension should not be linked to the government funding deadline. Democrats are also pushing to roll back the One Big Beautiful Bill Act's Medicaid cuts as part of the CR. The White House Office of Management and Budget has instructed federal agencies to prepare plans for permanent reductions in force should a government shutdown occur. These reductions in force notices would be in addition to any temporary furlough notices provided due to the lapse in appropriations. OMB told agencies to identify programs where discretionary funding will lapse on October 1st and no alternative funding sources available, and to eliminate those jobs that are not consistent with the president's priorities and are not legally required to continue.
Acetaminophen, is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. All pregnant women should
More news today,
talk to
where
their
President
doctors.
Donald Trump held a press briefing last week in which he told pregnant women to avoid Tylenol because of a link between the medication's active ingredient, acetaminophen, and autism. The scientific evidence to support this recommendation was not cited. During the event, U.S. Department of Health and Human Services Secretary Robert F. Kennedy Jr. also spoke about the risks of acetaminophen, asserting that it may also be associated with other neurological conditions, such as ADHD. The Food and Drug Administration reportedly started a public campaign about the drug and began the process of updating its safety label. The medical establishment pushed back, arguing that the president's remarks were not backed by data and that there are serious risks of untreated maternal fever to both women and their babies. FDA Commissioner Marty McCary, in a notice to physicians on the use of acetaminophen during pregnancy, acknowledged that the drug is, quote, the safest over-the-counter alternative in pregnancy among all analgesics and antipyretics, unquote. It also states that, quote, while an association between acetaminophen and autism has been described in many studies, a causal relationship has not been established, and there are contrary studies in the scientific literature, unquote. Senate Health, Education, Labor, and Pensions, or HELP Committee Chair Bill Cassidy, a Republican physician from Louisiana, has called on HHS to release the data tying acetaminophen use during pregnancy to autism, stating in a post on X that, quote, the preponderance of evidence shows that this is not the case, unquote. Secretary Kennedy touted the use of leucovorin during the briefing as a potential treatment for symptoms of autism. Administration officials have pointed to evidence that leucovorin, which is currently used to treat cancer and anemia, can also help some children with autism improve their verbal communication. Commissioner McCary has said that he has spoken with the manufacturer of leucovorin to increase production of the drug, and that he plans to fast-track approval of leucovorin as a treatment for children with symptoms of autism and cerebral folate deficiency. During Monday's event, the president also announced that the National Institutes of Health will be making 13 grant awards related to autism, asserted that vaccines for measles, mumps, and rubella should be given separately, and expressed opposition to giving the hepatitis B vaccine at birth. He expressed opposition to the inclusion of mercury and aluminum in vaccines, and made several unproven claims about the link between the childhood vaccine schedule and an increased risk of autism. The Government Accountability Office, or GAO, has issued a report on the extent of effects of physician consolidation. The GAO found that the percentage of physician consolidation into health systems increased from 30% in 2012 to 48% in 2024. The studies reviewed by GAO found that physician consolidation with hospital systems can result in increased spending and prices for insurers, including the Medicare program. The report was conducted in response to language in the House of Representatives' fiscal year 2023 Appropriations report requesting GAO study, quote, the extent healthcare consolidation is taking place across Medicare and Medicaid markets, and how private equity could be contributing, unquote. Final news today, where a bipartisan group of New York lawmakers have sent a letter to the administration expressing concern about the National Cancer Institute's decision to terminate funding for the Pediatric Brain Tumor Consortium and transition the consortium's function to the Pediatric Early Phase Clinical Trials Network. The letter argues that the change will result in the deprioritization of pediatric brain cancer trials in favor of other pediatric cancer trials. The letter reads, quote, a specialized center focused solely on pediatric brain cancer is essential to the success of brain tumor research in the future. It goes on to say, additionally, we have concerns that some patients may be lost in the fold during the transition, and that crucial time will be lost as well. For patients on the PBTC trials, every second counts, unquote. The letter was signed by Senator Kirsten Gillibrand, a Democrat from New York, and Representatives Laura Gillen, a Democrat from New York, and Michael Lawler, a Republican from New York. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week. and stay healthy.